Hi there, I'm Andrea Brognano. I'm a licensed mental health clinician specializing in anxiety, and today we're going to be talking about anxiety in children. In this video, we're going to cover types of anxiety in children, signs of anxiety in children, common behaviors that might cause anxiety, symptoms of anxiety in children, causes and triggers, and treatment options. The most commonly diagnosed anxiety disorders include generalized anxiety disorder. Those are the worriers and perfectionists. They may want to organize their toys or make lists. Social anxiety, the socially anxious child or adolescent that tends to be exclusive and judgment of others. Specific phobias. They will often go to great lengths and avoid coming into contact with the feared stimulus. Other anxiety disorders that might be seen in children include separation anxiety, a child who gets very upset leaving a caregiver. Selective mutism, might refuse to speak in certain environments. Panic disorder, purely a physical manifestation of anxiety, or OCD, PTSD, and adjustment disorder. These, although they're there, are not considered trauma-related disorders. They include an anxiety component. Signs of anxiety in children and what it looks like. Unfortunately, anxiety sometimes hides behind other behaviors that are often misdiagnosed as another disorder. For example, children with anxiety struggle to stay focused. As a result, they don't pay close attention to detail. They may interrupt to get their worries out quickly and don't appear to follow directions. They could also have a lot of nervous energy, frequently failing to remain still or seated when they're expected to do so. A child with these behaviors might meet the diagnostic criteria for ADHD, but when the source of their behavior is explored further, an anxiety disorder could more accurately capture their experience. Treatment goals can therefore be tailored to the root of the behavior. Other common behaviors that may reflect anxiety in children also include avoidance or extreme panic or distress when encountering a feared stimuli. Example, racing heart, clammy hands, sweating, dry mouth, shaky hands or body, or warm or hot face. Psychosomatic symptoms such as headaches, stomach aches, gastrointestinal issues, chest pain, or dizziness without any known medical cause. A persistent and unrelenting need for control or perfection. Think about getting upset with simple mistakes. An unwillingness to be flexible when the plans change, sometimes resulting in tantrum-like behavior. Difficulty falling or staying asleep, crying, nightmares or night terrors, and a need for constant comfort or reassurance. Symptoms of anxiety in children. Each of the anxiety disorders has its own set of symptoms. However, there's significant overlap among them. Anxiety is the brain confusing non-threatening situations with those that are actually dangerous, and the fight or flight response is then activated. So, the more common symptoms of anxiety include persistent and excessive panic or distress when either directly experiencing or anticipating that a trigger will happen, worries and or fears impossible to control, extreme irritability, especially in response to non-structured settings, fear is out of proportion to the actual threat that's posed, recurrent avoidance of the object or experience, presence of symptoms for an extended period of time, often more than 6 months. An experience must cause significant distress or impairment in areas of functioning, such as academia or social spaces. Symptoms must not be better accounted for by a medical condition or other diagnosable mental behavioral health disorder, such as autism spectrum disorder. The various causes and triggers of anxiety in children include the causes of anxiety disorders are considered a combination of both nature and nurture. Genetics and brain chemistry are considered two of the most common factors that contribute to a predisposition for anxiety. Children with close family members who have also had an anxiety disorder are more likely to experience one themselves. Genes can also play an impact on the production of certain neurotransmitters or chemicals in the brain that, when excess, short supply, or are not functioning properly, can also cause an extreme anxiety response. Children with a behaviorally inhibited temperament or who appear shy may also be at an increased risk. Significant life events and reinforcement of avoidant behavior can trigger and or exacerbate existing anxiety. Life events that can increase a child's risk for developing an anxiety disorder include the loss of a loved one or attachment figure, changes in familial structure, or witnessing or experiencing violence or abuse. These are typically more challenging to cope with and therefore may place a child at an increased risk. However, even seemingly insignificant situations can also trigger an anxiety response, such as experiencing pain when receiving a shot or being stung by an insect. Did you know that caregivers often inadvertently reinforce their child's avoidance of anxiety, producing triggers? For example, when a child is acting shy and their caregiver continually speaks for them, a pattern may develop that prevents them from building their own confidence in managing their anxiety, perpetuating it instead. And being overprotective, keeping excessive control over their child, and struggling to manage their own anxiety are a few other ways that caregivers can negatively impact their child's increased worry. Treatment of anxiety in children includes a number of different approaches to treating anxiety in children and adolescents. For example, their anxiety may be so severe that only pharmacopsychotherapy, example medication, will reduce their symptoms enough to be able to engage in psychotherapy. Although medications show some effectiveness in treating anxiety, they often do not independently lead to the same long-term effects that psychotherapy and lifestyle changes can produce. Some treatment options include therapy. CBT, or cognitive behavioral therapy, is the most common evidence-based psychotherapy for anxiety. This helps children challenge negative thoughts while also teaching the behavioral component to learn relaxation techniques and gradual exposure. Medication. The two most popular medications to treat anxiety in children are antidepressants and benzodiazepines, which are supported by research. These are most often prescribed through a primary care pediatrician or psychiatrist and are less likely to address anxiety as a whole. So how do you get help for your child with anxiety? There are various ways to seek support for a child struggling with anxiety. At times, a teacher will notice anxious behavior and reach out, either directly or through a school counselor. Some schools provide adjustment counselors for children who struggle with mental challenges in the academic setting. Some families choose to begin with their primary care provider or pediatrician. They may prefer to rule out medical causes for their child's symptoms and trust the referrals provided by their family physician. Others will ask close family members or friends for referrals to a therapist or agency. Some folks will simply conduct an internet search looking for specific criteria in person that they choose to work with their child. Regardless of the means to get a clinician, what's most important is the fit between the provider and the family. Not every therapist will connect with the child good way or be the most effective for their needs. Request consultations, asking questions that are important to you, setting up a meeting between the clinician and the child, and if possible, don't be afraid to shop around until a good clinician is fit for you. My final thoughts are that anxiety is one of the most commonly diagnosed mental disorders in children, and adolescents can take many forms or be misdiagnosed for a behavior problem. There are several means of managing anxiety, both therapeutically and through lifestyle modifications. Find what works best for you and your family.